Good morning, everybody. Welcome, and thank you for joining us for this webinar on the WA Cares Fund. Today we will be covering WA Cares basics, what workers need to know. My name is Kristen Mackey, and I am the WA Cares Fund Community Relations and Outreach Program Manager. We will have time at the end of today's presentation to answer any questions that you have. Anyone who has joined us on a computer or using the Zoom app on their phones can submit their questions through the Q&A function at any time in the presentation. If you joined by calling the phone number but want to ask a question, we recommend finding the link to join by computer or the app in your email or on our website at wacaresfund.wa.gov/webinars. So let's get started by defining what we're talking about when we say long-term care or caregiving. Long-term care is help with activities of daily living like bathing, eating, dressing, preparing meals, grocery shopping, and more. It does not include medical care like doctor's visits and treatment for medical conditions. Long-term care covers a broad spectrum of needs and circumstances, including for younger people who have been unexpectedly injured or become disabled or ill. And a lot of people don't realize how many different services and supports are included when we talk about long-term care. We often think of it as care in a residential setting, like a nursing home or assisted living, but it can also include care provided in your own home. In fact, most people with long-term care needs can stay in their own homes with the right support. It's also very common for family caregivers to not realize that they are a caregiver. You might go to your mom's house a couple times a week to cook meals, drive her to appointments, and make sure she's taken her meds, which are all common care activities. The majority of this type of care is provided on an informal basis as unpaid care from a family member, a friend, or a neighbor. So I am going to go ahead and start a poll about experience with long-term care and caregiving and familiarity with the WA Cares Fund. If you joined on your computer or the Zoom app, I appreciate it if you could go ahead and fill in your answers to that so we can learn more about who we have in the audience today. Give folks just a minute to fill that out. Right. I'm not sure if there's an error, but I'm still seeing a 0% participation rate in that. Oh, some folks are saying that the survey went away. Let me try relaunching it. Okay. There we go. Thank you. I'm just going to give folks another quick minute. Thank you so much for filling that out for us. All right, I'm going to go ahead and end that poll now. And we'll go ahead and share the results so everyone can see. We've got a good contingent of people here today who work in long-term care or a related field, and a lot of folks who have either provided unpaid care to a family member or loved one in the past or are doing that right now. And we also have about 23% of people don't have direct experience and aren't very familiar with long-term care. So I hope today's presentation is helpful for you. It looks like we also have a lot of people who are only somewhat familiar or not very familiar with WA Cares. So we hope that today's presentation will be useful. What we saw in that poll is really consistent with what we see in the general population. In general, we all have care stories in our families and our communities. Family caregiving is really the bedrock of long-term care. We have 820,000 family caregivers in Washington State, which is about 11% of our population. And I want to start by sharing a story from a Washington family doing the kind of caregiving that WA Cares will support. And let me go ahead and start this video. Oh,
My mom was a nurse anesthetist in Korea, and we're both nurses. So kind of runs in the family. That was part of the reason why we were able to come here in 1974, because she had worked as a nurse and they wanted nurses to come. So she was able to bring the whole family. Just a couple of years ago, we started noticing that my mom started to have some cognitive decline, kind of on the spectrum of dementia. Yanni and I have had to kind of put our jobs on the back burner to really help take care of my mom. Some days were good, some days were very difficult. I mean, it's our mom, and there's nothing I wouldn't do for her to make sure she stays as independent as possible with the support that we can give her. If we had a resource like Walk Cares, that would have been so helpful to just kind of ease some of our financial burden in trying to do this. It's very difficult. So we try to simplify her life. We do her grocery shopping, and she often will come with us, and cooking, cleaning, cutting her hair, taking her out socially. But we're creating meals that she is familiar with and that she enjoys. And we like to bring her out to do fun things too, and not just like all medical all the time. Believe me, it will affect you, whether you're younger or older. To have a resource like that and to know that the state is investing in families, that means a lot to me. Walk Hairs is a program that I think will benefit everybody.
great. So, much like Sunny and Yanni's mother, 70% of us will need long-term care at some point in our lives. And the problem is that long-term care can be really expensive. It costs almost $36,000 per year for 20 hours of home care per week, which is the average that's needed by current Medicaid long-term care clients. And it's also important to keep in mind that family caregiving isn't really free either. We'll talk about that a little bit more in a second. Because long-term care is not medical care, it's not covered by health insurance or Medicare except in very rare circumstances, and it's only covered by Medicaid after you've spent down your life savings to just $2,000. Even though long-term care is a predictable cost, most of us don't have a way to pay for it. The median household income for Washington seniors is about $56,000 per year, and 41% of Washington workers who are near retirement have no projected retirement income from a pension, 401k, or IRA. And another 42% have no pension and only enough savings to replace about 10% of their pre-retirement income. This is especially critical because our population is aging rapidly. The number of people who are 85 and older, which is the blue line on this graph, will more than double between 2020 and 2034. And the caregiver support ratio is also declining really sharply. And what that means is that a lot less family support will be available for people in high risk years for needing care, and family caregivers will be more likely to be providing care for multiple loved ones at a time. So, as a society, we'll need to provide better support for caregivers and find new ways to help families with long term care needs. And while Walk Cares may seem like a new expense for workers, it's important to keep in mind that the current system of relying on unpaid family caregivers to provide the vast majority of care isn't actually free for those families. Almost half of family caregivers experience a related financial setback. Caregivers spend on average 25% of their own income on care-related expenses. And it's really common for caregivers to leave the workforce early to provide care. Caregivers who are 50 and older who do this lose an average of more than $300,000 in wages and benefits. And most working caregivers say a program that paid them for the hours that they provide care, like Walk Cares will be able to do, would be helpful for them. We also know that the majority of caregivers work full-time on top of their care and family responsibilities, and most of those working caregivers report that it impacted their job in some way. Over half say that they have to go in late, leave early, or take time off to provide care. 15% report reducing their hours. Many, about 8%, report receiving warnings about their performance or their attendance, turning down a promotion, quitting, retiring, or losing benefits. And while many caregivers find their role rewarding, it can also be highly stressful. Nearly 1 in 4 report that their health has worsened since they took on the role. Long-term care is also a significant driver of state budgets and accounts for about 8.9% of the state budget. We don't often think about it, but these costs are paid for by all Washingtonians through taxes on goods and services. And as our population ages, costs will rise accordingly. So without the Walk Cares Fund, sales and other taxes would have had to go up significantly to meet the needs of our aging population. So with all of these challenges in mind and facing a projected doubling of Medicaid long-term care costs by 2040, the state's Joint Legislative Executive Committee on Aging and Disability began a search in 2014 for a long-term care public policy innovation that would preserve and protect that Medicaid budget, offer affordable long-term care insurance coverage, provide financial relief to middle-class families and their caregivers, and be financially viable and sustainable in the long run. JLEC, that committee, spent several years working with stakeholders, policy experts, and actuaries to explore both private and public solutions. And after extensive research on each of those approaches, the findings were clear that a program like Walk Cares that covers everyone, similar to Social Security and Medicare, is the only way to provide affordable coverage for all. So with all of that research and best practice in mind, the legislature enacted the LTSS Trust Act in 2019, creating Walk Cares. And in 2021 and 2022, the legislature made improvements to the program's coverage and benefits. Workers began earning benefits in July 2023. And then this year, the legislature gave workers the ability to take their benefit out of state if they move. We'll talk a little bit more about that later in the presentation. And finally, in July 2026, the benefit will become available to those who qualify. So let's talk about how Walk Cares works. Walk Cares is a universal long-term care program in Washington state. It's an earned benefit, which means you contribute for a certain number of years in order to qualify for benefits. It's entirely self-funded by workers' contributions, which go into a dedicated trust fund used only for this program. Workers contribute 0.58% of every paycheck to Walk Cares, and there's a graph on the screen that shows you what that looks like for the typical worker who makes just over $50,000 a year and would contribute $291 to Walk Cares each year, or about $24 per month. You only contribute to Walk Cares while you're working. Contributions stop when you retire or if you become unemployed. Everyone is covered at the same rate, regardless of pre-existing conditions. And when it comes time to claim your benefits, there are no copays, no deductibles, and you don't need to file claims or pay upfront for services. Instead, we connect you with contracted providers who offer the services that you want, and Walk Cares pays those providers directly. This is what those contributions can look like over the course of a career. The typical worker's income that we talked about is just about at the level in green here in the middle. So you can see that $290 in contributions each year totals out at $8,700 over 30 years. Almost all Washington workers contribute to Walk Cares. To determine whether someone counts as a Washington worker, we look at whether their work is localized in Washington. And that is technical term. Determining whether the work is localized in Washington can be complicated, but because we use the same definition as the state's paid family and medical leave program, that gives us an easy rule to work from, which is that workers who are included in paid leave will also be included in Walk Cares, are also included in Walk Cares, unless they have an approved Walk Cares exemption from the Employment Security Department. If you're not sure whether you participate in paid leave and Walk Cares, you can check your pay stub or ask your employer for more information. If your work is not localized in Washington, for example, if you work in Oregon, you are automatically not included in Walk Cares. No need to file for a Walk Cares exemption. Federal employees are also automatically not included. Employees of tribes are only included if the tribe opts in, and self-employed people are only included if they opt in. Other workers may be able to get an exemption from Walk Cares, which they must apply to the Employment Security Department to get. So there are some workers who can apply for an optional exemption that's based on meeting certain conditions. That includes workers who live out of state but work in Washington, temporary workers with non-immigrant visas, and spouses or registered domestic partners of active duty military. These 3 exemptions were created for groups of workers who would be unlikely to qualify for or use their benefits, and they are available on an ongoing basis, but they are conditional, so the person must continue to meet the exemption criteria to maintain their exemption. There are also 2 types of permanent exemptions. Veterans with a 70% or higher service-connected disability rating who have access to some nursing home care through the VA can choose to apply for a permanent exemption, and these applications are available on an ongoing basis. There was also an exemption available in the past for workers who had private long-term care insurance before November 2021. These applications are no longer available, but under current law, workers who already have an approved private insurance exemption will continue to be exempt permanently. For details on exemptions and how to apply, you can visit wahcaresfund.wa.gov/exemptions. If you are self-employed, you can choose to opt into the WaCares Fund and protect yourself with the same affordable benefits that are available to other Washington workers. Like other workers, you would contribute 0.58% of your earnings, so that includes your net earnings and any gross wages paid to you from your business entity. And to earn benefits, you must work at least 500 hours per year. For self-employed people who opt in to WaCares coverage, this is calculated by dividing your gross annual wages by the current minimum wage. Applications to opt in as a self-employed worker are available on our website at wahcaresfund.wa.gov/opt-in. All right, let's talk about qualifying for benefits. Everyone who is contributing to WaCares more than 500 hours per year is earning benefits, part-time and temporary workers included. By contributing for a certain number of years, you earn access to the benefit amount, which is $36,500. There are 3 pathways to meeting the contribution requirement. The first is lifetime access, and this is the pathway that we expect the majority of Washington workers will use to qualify for benefits. So to use this pathway, workers must contribute for 10 years without a break of 5 or more consecutive years. And this pathway earns you access to the full benefit amount, that $36,500, which grows over time with inflation. The next pathway is early access. So for workers who have not yet earned lifetime access, but have a care need either while they're working or soon after leaving work, they may be able to qualify through this pathway. So for this pathway, you need to have contributed for at least 3 of the last 6 years at the time that you need care and apply for benefits. And this pathway also earns you access to the full benefit amount of $36,500. Then finally, we have a special pathway for people who are near retirement. If you were born before 1968 and are therefore near retirement as the program begins and unlikely to qualify for the 10 years pathway, you can earn 10% of the full benefit amount for each year that you work. So for example, if you work and contribute 500 hours or more per year for 3 years, you would earn 30% of the benefit amount, or just under $11,000, which will also be adjusted for inflation. Near retirees have permanent access to whatever percentage of the benefit amount that they earn at the time that they need care, and they are also able to qualify through one of the other pathways if they meet those requirements as well. Once workers meet contribution requirements and need help with at least 3 activities of daily living, they can get access to their benefit amount, which they receive in the form of services and supports. So with WaCares, workers get the flexibility to choose the services and supports that meet their needs. That could mean in-home or residential care, but it could also include home modifications to make their home safer and assistive technology for things like medication reminders and fall detection that can help with some care needs. WaCares is really designed to help people age in place in their own homes as long as possible. That's what almost all of us want to do, and most of us can if we have the right supports. WaCares has many options to provide support for family caregivers. You can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, even your spouse. And WaCares can help lessen the impact on family caregivers either by paying them for their time or by making sure that they can get other support services. We get asked a lot about how far the benefit amount will go. And while it won't cover 100% of care for everyone, it would cover the amount of in-home care the average Medicaid client uses for roughly a year. About a third of people need care for a year or less, and for those people, depending on which services they choose, WalkCares may be able to cover all the care that they need. For others, WalkCares provides the family with immediate relief and time to plan for future care costs. So here are some ways, some examples of how someone might use their benefit. They could pay a family member to care for them for about 10 hours per week for 2 years and get care supplies for a total of about $33,500. Or they could choose services to help them stay safely in their own home. They could purchase $15,000 worth of renovations like bathroom modifications or a wheelchair ramp to improve their home's accessibility, get an electric wheelchair or scooter, and have meals delivered for 3 years for around $26,800. Or someone who needs long-term care due to an unexpected injury could get 20 hours of in-home care per week for a year, plus transportation to appointments and crutches for about $34,600. We also have some great news from last legislative session. The legislature passed a new law allowing people to take their WalkCares benefit with them if they move out of state. Under the new law, starting in July 2026, Washington workers can choose to continue participating in the WalkCares Fund if they leave Washington. To become an out-of-state participant, workers must have contributed to WalkCares for at least 3 years, in which they worked at least 500 hours per year, and must opt in within a year of leaving Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years, and the state will create a process for participants to report their earnings and pay premiums with a focus on making it easy for participants. And then benefits will become available for out-of-state participants starting in July 2030. WalkCares is a cross-agency program, and multiple agencies at the state have responsibilities in designing, developing, and implementing the program. So here is just a little breakdown of those responsibilities, so you have a sense of where you might go for questions. If you have questions about exemptions or opting in as a self-employed person, ESD, the Employment Security Department, is the right place to go. If you have other questions, you can connect with the Department of Social and Health Services, or DSHS. You'll also work with DSHS in the future as you apply for benefits and get a care need assessment. HCA, the Healthcare Authority, has a responsibility for paying providers, and the Office of the State Actuary is responsible for ongoing analysis to make sure that the fund stays on solid ground financially. And if you're not sure which agency you need to direct your questions to, on our website, on our contact page, you will find those details as well and contact information for each agency. And with that, we are going to go ahead and start question and answer portion of the webinar. So I'm just clearing out a couple of these that we have answered during the presentation. And we've got, let's see, someone asking what happens if I have, oh, sorry, that question got answered in text. We've got someone asking what happens if I had a private long-term care policy and an exemption, but I cancel that long-term care policy. Does the employer start charging for WalkCares after the policy cancels? No. So under current law, private insurance exemptions are permanent, and we recommend that you speak to your broker or the agent who sold you the policy to receive advice on whether or not you maintain that policy. Then we've got someone asking, how is filing out of state premiums calculated? Is it the same as in-state? And how does the out-of-state participant prove the earnings? So the calculations, it is the same amount. It's still 0.58%, just the same as in-state participants. And we are still working on what the process for reporting and paying premiums is going to look like for those participants. But keep an eye on our website and sign up for our newsletter, and we'll continue to share updates as that process is developed. And then we've got someone asking how a year is determined, and whether it is a calendar year, and whether the first year when we started in July, if that counts as a year. So the Employment Security Department is working on administrative rules for WACARES that will cover what counts as a qualifying year. ESD intends to define a year as January to December, so yes, a calendar year. They won't finalize the definition until rulemaking is complete, but you can sign up for rulemaking updates on the website if you'd like to stay informed. Assuming that they do finalize that definition as a calendar year, anyone who worked 500 hours in that July to December timeframe in 2023 will have earned a qualifying year in 2023. And then let's see, we've got someone asking if self-employed person can file annually. The self-employment filing process is done quarterly. We've got someone asking if there will be an employer resource webinar in the future. We did hold a WACARES Basics for Businesses webinar this July, and that recording is available on our website at wacaresfund.wa.gov/webinars if you want to take a look at that. There are also some past webinars that go into more detail on reporting that are also linked from that webinars page. So that may be a useful resource for you. And then we've got someone asking if I opted out back when this started, so I assume a private insurance exemption, am I able to opt in and have both WACARES and private insurance? Unfortunately, at this time, the private insurance exemptions are permanent. However, the LTSS Trust Commission has made recommendations to the legislature that there be a one-time limited opportunity that anyone who has a lifetime exemption would be able to permanently join the WACARES Fund. So that is still something that would require legislative action to implement. And if the legislature makes changes to the law, ESD will communicate directly with any workers who have exemptions to explain their options. We'll also, of course, update the website and our mailing list. And then we have someone asking if the $36,500 benefit is a one-time benefit only. Yes, that is the lifetime benefit amount, and it does grow over time with inflation, including after you have retired and stopped contributing. And then we've got someone asking if employers are supposed to mention WACARES to employees during the hiring process in case they qualify for exemptions. There is no requirement under the law for employers to communicate with workers about WACARES, but we do have some great resources available on our website at wacaresfund.wa.gov/employers and in our toolkit at wacaresfund.wa.gov/toolkit. And you can use those materials to share information with employees. We do recommend, while it is not required, we do recommend that you share information, particularly with new hires, especially anyone who might be coming from out of state and unfamiliar with the program. We've got somebody asking if I retire and after a few months or a year return part-time, will my contributions restart? Yes, as long as you are working in the state of Washington and don't have an exemption to WACARES, you will contribute to the program. And that is for folks who are near retirement. One way that you may find you can earn additional qualifying years through that near retiree pathway to increase your benefit amount that you have permanent access to. A lot of folks end up working part-time after they retire, so that may be an additional benefit if you choose to do so. We've got someone asking how are funds distributed to the beneficiary. So rather than distributing funds to the beneficiary, how it will work is you will apply for benefits, and once we assess that you do need care and that you have met the contribution requirements, then you will be able to find a WaCares contracted provider who offers the services that you would like to receive, and WaCares will pay that provider directly. And we've got someone asking, is WaCares only for services of the state employee and not spouses or partners? So for clarity, you don't have to be an employee of the state. You just have to be a worker in Washington. But yes, it is for services for the worker who has earned that benefit rather than for spouses. And then we've got, let's see, someone asking, with this new benefit, how the state is anticipating to increase training and employees for caregivers as more people have access to the benefit. A couple things. First, WaCares is really structured to ensure that benefits can be used for a wide range of services and supports, not just care from a professional caregiver. So you can make a family member, even a spouse, a paid caregiver, and that will allow beneficiaries to tap into other sources of support, even when the number of professional caregivers available is limited. WaCares benefits can also be used to buy assistive technology for things like medication reminders and fall detection that can help with some care needs. But we know that with the shortage of professional caregivers, this is an issue that we're taking really seriously. We have a dedicated team that is focused on developing our provider network and recruiting providers to contract with the program. And that team is working closely with the Area Agency on Aging staff that are responsible for local planning to support availability of long-term care services. And beyond WaCares, of course, there are many efforts underway at the state and national level to address the workforce shortage, including DSHS's workforce development team, which supports caregiver training programs, develops resources for workforce retention, and conducts outreach on careers in caregiving. And then we have someone asking whether you must have 3 reasons for needing help before you can file for benefits. Yes, you do need to need help with at least 3 activities of daily living, like bathing, eating, dressing, and that sort of thing. We have a full list available on our website if you're interested in learning more about what activities of daily living are considered. Then we have someone asking about the cross-agency responsibilities, saying that we listed 4 agencies responsible, but not WaCares, and whether it's under one of the other agencies. So WaCares is a cross-agency program. There are staff that work on WaCares at each of those agencies that we talked about. So it's not its own agency. And then let's see here. We've got someone asking about whether someone needs to be a family member to get paid to provide care for the elder, and not necessarily. We have a few requirements for family caregivers that they'll have to meet in order to become paid caregivers through WaCares, and we're still looking at what that might entail. But as a general rule, family caregivers will sign up as a provider through WaCares and will be paid through the Consumer Direct Care Network of Washington, or CDWA, which is an organization that supports family members and loved ones who wish to be paid by the state to provide those personal care services. Home care agency can also employ a family member or loved one as a certified home care aide, and DSHS is developing a third option to pay family caregivers to provide more flexibility for WaCares beneficiaries. but all paid family caregivers will need to participate in some kind of training to ensure health and safety for both themselves and their loved one. And then we have a couple of folks asking about Initiative 2124, which is on the ballot this fall. When it comes to the initiative, our role at DSHS is really to implement the program as outlined in the statute, and we're continuing to implement the program according to current law. We have limited ability to speak to the initiative, but if you're interested in more information on potential impacts, there are a few resources that may be of interest to you. I'm going to go ahead and drop those in the chat with some links. So the Office of the State Actuary has contracted with Milliman, which is a worldwide provider of actuarial services, for an analysis of the financial impact of voluntary participation on the program and the program's finances. The Senate Labor and Commerce Committee also held a work session where experts presented information on potential impacts of making the program voluntary, and you can watch that work session on TVW. And finally, OFM, the State Office of Financial Management, has published a fiscal impact statement on the initiative that includes information from the state agencies that administer walk cares. So you can take a look at those resources if you'd like more information on the initiative. And let's see. We've got someone asking about whether recipients of care need to be seniors, or if anyone who has contributed for qualifying years, for the right amount of qualifying years, receive assistance for conditions that require long-term care. So there is no age requirement. You don't have to be a senior in order to use your Walk Cares benefit. And in fact, particularly younger workers who have disabilities or an accident or some other reason that requires them to need help with at least 3 activities of daily living, are able to access their Walk Cares benefit as long as they have met contribution requirements. And then we've got somebody asking, are there flyers or materials we can provide to clients to help them connect with Walk Cares? And yes, I'm going to drop a link in the chat to our toolkit, which has some flyers in a number of languages that you can share with clients, either as community organizations, long-term care providers, and also as employers. There's a lot of great resources available there. And then regarding the, says the new 2026 policy, I think referring to out-of-state coverage, taking your benefit out of state. If I move out of Washington, does my employer in the new state need to deduct it out of my paycheck? So if you're an out-of-state participant, you will be the one who is reporting how much income you had and paying premiums to Walk Cares. And we're still working out what exactly that process is going to look like. And we're really trying to focus on how we can make it as simple as possible for those participants. And then we've got someone asking, will those living out of state submit claims the same way in-state users do? So claims isn't really how Walk Cares works. Instead of having folks pay upfront for services and then submit a claim to get reimbursed, we pay the providers directly. And for out-of-state participants, it's going to be very similar, the way that you receive benefits. We are planning to, let me see, we are planning to partner with one or more nationwide vendors to register and contract with providers in all states. So that's something that we still have in process, and more information will be available by the time out-of-state coverage opt-in becomes available. And then we've got someone asking whether it can be used in Canada if you move there. The processes and policies for that out-of-state coverage are still in development, and it's not yet clear whether we'll be able to offer out-of-state coverage outside of the US. But we are working on that and we'll have more information available in the coming years. And then we have someone asking, can this fund be used intermittently? And I think if what you're asking is whether you can use some services and then stop using services and then use services again, yes, you don't need to use kind of all of your benefits in one certain amount of time. So yes, as long as you meet the eligibility requirements. And then we've got someone asking whether the same rules apply for financial recovery, I assume as Medicaid. No, there is no financial recovery, a state recovery process for WA Cares. It's just an earned benefit that you're able to use when you need care. There is no financial assessment required. You don't have to have certain asset or income limits in order to qualify for WA Cares benefits. You just need to have met the contribution requirements for that number of qualifying years you've contributed and the care need requirement. So you need help with at least those 3 activities of daily living. And then we've got, let's say, will an early retiree born after 1968 still qualify for partial benefits if they only pay in for 5 years? No, anyone born after 1968 needs to qualify through one of the first 2 pathways that we talked about. So either by contributing for 10 years without a break of 5 or more consecutive years, or if they need care soon after retiring, if they have contributed for at least 3 of the last 6 years at the time that they need care. And then we've got a few folks asking for information for providers and about what requirements providers will have to meet to contract with WA Cares. So providers will need to meet basic laws of doing business in Washington and may need to meet licensing or certification requirements depending on the type of services and supports that they offer. So the LTSS Trust Commission, which is our oversight body, is currently developing recommendations on provider qualifications for each type of provider that will be contracted with WA Cares. And those recommendations will be published on our website by January 2025. There are some details on the process that are available online on the commission webpage, which I will drop in the chat now as well. And then let's see. We've got folks asking for care provided by a family member or friend. Will WA Cares pay that person directly like they will a WA Cares contractor? Yes, most frequently through CDWA, which is the organization that we talked about that is the payer for those independent providers in Washington. And then let's see here. Just checking for we've got someone asking about portability. If I move to Oregon and continue payments, can I utilize these funds if eligible while living out of state? Yes, you are able to take your benefit with you. You just need to have worked and contributed to WA Cares for at least 3 years and opt in within a year of leaving Washington as an out-of-state participant. And then we've got a few folks asking about those care needs assessment and how the state will assess care needs for beneficiaries. So the state is still working on some of those details for what the process is going to look like, but broadly speaking, you will submit an application and answer a few questions about your care needs that will be reviewed by our team at DSHS. And then you will be able to schedule a time to talk with a representative about your care needs, either in person or over the phone. And then we, after that, will make a determination and notify you about whether you qualify to start receiving your benefit. And if you don't qualify, then you will have the option to submit an appeal. So that's just the kind of broad description of how that's going to work. And then for early access to full benefits, which is that pathway where you need to have contributed for at least 3 of the last 6 years at the time that you need care. We've got someone asking what the earliest is that participants can start receiving benefits, and that is in July 2026. So after you've contributed for 3 years. And also for near retirees, they may have earned 1 or 2 years of that prorated benefit prior to July 2026, but July 2026 is the first time that benefits will become available for in-state participants. And then we've got someone asking when the 2025 schedule will be posted on the webinars website that we shared. We are working on developing that right now. If you're subscribed to our newsletter, you may have seen our surveys asking about interest in 2025 topics. And we are working on finalizing that and should have that posted on the website in the next couple months. And then let's see, what time are we at? Okay, we've still got a little bit of time. We've got someone asking for self-employed folks who only compute profits at their year end and don't have any earnings to report for specific quarters. How do you report their hours worked each quarter with no earnings? So generally speaking, for employers, there is a no payroll report that you can submit in quarters where there was no payroll. But for this specific situation, it's always best to reach out to our team at the Employment Security Department, and they can help you out with specific questions about your reporting situation. And then we've got someone asking about whether they participate as they work hybrid in Oregon and live in Washington. And that is another kind of complicated question. We recommend reaching out to the Employment Security Department to see whether you meet the definition of having your work localized in Washington. And for these folks who have some of these kind of specific detailed questions, I'm dropping a link in the chat for where you can get contact information for each of the agencies. Looks like it didn't come through quite right. There we go. And then we've got someone asking, I have an employee close to retirement. Are funds available post-retirement? The program doesn't make funds available as like a cash payout to beneficiaries. Instead, we pay the providers who offer the services that the beneficiary wants to receive. So funds are available once they have met contribution requirements and need care. And then so we've got someone saying, I'm past retirement age and only working now because I need to continue working, and is asking if they've only contributed 2 years, would they have to work until they're 75 to get this? No, because I assume if you're past retirement age, were born before 1968, you will qualify for that near retiree pathway that we talked about. So you earn 10% of the full benefit amount for each year that you work. So if you've contributed and earned 2 qualifying years, then you will have earned 20% of the full benefit amount that is available at any time that you need care in your life. Or if you happen to need care soon after you stop working and have worked 3 of the last 6 years at the time that you do need care, you may be able to access the full benefit amount instead. And then let's see, someone asking, can a spouse be paid or only non-married family members? You can make any family members a paid family caregiver, including your spouse. And there's a couple questions that we may need to follow up with after the webinar that are a little more specific. I think we have reached the end of the questions that we're going to be able to answer for today. So I'm going to share my screen again real quick. Just one moment. Here we go. So before we close out, I just want to recap some of the ways that Walk Cares can benefit you, your family, and your community. So you may directly benefit from Walk Cares either by receiving care yourself or getting help caring for loved ones. But you may also see the impact of Walk Cares at work as your coworkers with caregiving responsibilities get more support. And not only will Walk Care serve as a financial resource for families, but the ability to make a loved one a paid caregiver will help keep the benefits that workers earn in their families and communities. Walk Cares will also ensure that workers throughout the state can access affordable long-term care coverage for the first time, and it will lower the costs of long-term care spending that we all pay through taxes. Walk Cares will help Washington families meet the challenges of our aging population and make sure that workers have more choices to help them live with dignity and independence as they age. And this is some of our contact information. Again, you can find the slides from this webinar as well as a recording on our website at walkcaresfund.wa.gov/webinars. You can contact us by email or by phone if you have additional questions. And we will also follow up with anyone who had a question that we weren't able to get to during the webinar itself. And that is all we have for you today. Thank you so much for making time to join us. We appreciate all your questions and don't hesitate to reach out if you need anything else. We'll see you all next month for a webinar on resources for new family caregivers. Thanks so much.